Hey guys, welcome back to my channel for your stimulus package and stimulus check update. If you don't care, hit the subscribe button, thumbs up, much be appreciated. We've got some news to go over. Now, you all may have heard or may not have heard, but Donald Trump in Charlotte, North Carolina on the 24th signed executive order, and he's going to be issuing and sending out $200 debit cards for people that's on Medicare, that's got the insurance Medicare, for like your co-pays or medicines that you can't afford. Now, I know that's not a whole lot of money, but right at this moment in time, anything is better than nothing. Now, I've not went over this yet. I don't know if you can use the, now it'll be a couple weeks before you would get them, and you'll receive them in the mail. Now, I've not went over this yet. I'm going to read it now to you all, and we'll find out together. But I don't think you can just like get cash off of it. I think it's to use for at the drugstores or you know, like that, for your medicine, co-pays, and so on. I don't think you can get cash off of it. That's a help. I mean, people really, that's a help. I mean, like I said, anything is better than nothing. But let me read this, guys. Now, the key points to this was President Trump said in a speech that cash cards will soon be sent to millions of seniors using the government health insurance program, Medicare. The provision is possible, the President said, partly because of the tremendous money that we're going to be saving with the foreign nations and various other things that we've done. But that plan is not yet being enforced, and administration officials offered few details on how the cards would be funded. Now, in his speech unveiling his health care vision for America, President Donald Trump made a surprise announcement that cash cards will soon be sent to millions of seniors using the government health insurance program, Medicare. Under my plan, 33 million Medicare beneficiaries will soon receive a card in the mail containing $200 that they can use to help pay for prescription drugs, Trump said in North Carolina on Thursday evening. But it's unclear how exactly the administration will pay for the cards. Now, a White House official told CNBC in an email that the money for the cash cards would be paid for by a Medicare 402 demo and and the cost would be offset from most favored nation savings. Now, the official did not immediately respond to a request for further details about the 402 demo or how it would supply the funds. But Medicare waivers under Section 402 now to apply to the experimental ways to cover costs and provide services. Now, this will be actual discount cards for prescription drug copays and will be mailed in the coming weeks, the official wrote. The Wall Street Journal, citing an administration official, reported Friday that the money would come from a Medicare trust fund, and according to an application for Medicare 402 waivers, such demonstrations must be budget neutral, meaning that the expected costs under the demonstrations cannot be more than the expected cost were the demonstration not to occur. Now, the $6.6 billion provision is possible, Trump said Thursday. Now, partly because of the tremendous money that we're going to be saving with the favored nations and various other things that we've done. Now, the President appeared to be referring an executive order revealed earlier this month, directing his Health and Human Services chief to work to test a payment model Now, ensuring that Medicare Part B covered products will cost no more than the most favored nation price. Now, Part B covers crucial medical treatment and preventive services. Medicare Part A covers inpatient care. Now, here the term most favored nation price means the lowest price for a product that a drug manufacturer sells to organization for economic cooperation and development members of a comparable size. Favored nations is a term often seen in health law contracts that requires providers to give one party equal or better rates for services than it gives other parties. But the White House's favored nations plan is not yet being enforced. Now, and it has already been opposition from the pharmaceutical industry, along with some groups focused on seniors' health. The policy is founded on incorrect assumptions about how other countries would respond, where seniors' high out-of-pocket costs really come from, and what it would mean for the U.S. to adopt cost-effectiveness standards used by foreign governments. But now, for aging research, a Washington, D.C. based nonprofit is in the call with the reporters Friday morning. A senior administration official offered few details about the plan to pay for the cards. Now, again, unfortunately, the details of the offsetting requirements of the 402 program are still yet to come. But now expect more details out of the White House in the near future, which means in the next days or the next week or so. Now, the official said, once again, the savings and the way that it will be paid for, more details are forthcoming from the White House. The timing for when the cards will be going out as soon as it is mechanically possible. The official said, while nothing that not all of the cards will be going out prior to the election. Now, the move appeared to echo one prong of a plan between the White House and the pharmaceutical industry to lower drug prices. Now, that was scrapped after Chief of Staff Mark Meadows insisted drug makers fund cards loaded with $100 for seniors to be sent out before November. The Times, the sitting for people familiar with the discussions, reported drug companies' concerns about being involved in a move that would look like a late game play towards Trump's re-election efforts. Now, most likely, in my opinion, he's just doing this to try to help his upcoming election. It's my opinion. Now, nearly $7 billion handout announced less than 6 weeks before Election Day quickly bred associations that the Trump administration was using government money to appeal to older voters. Healthcare news outlet, now the state news, for instance, called The Pledge, which is a political ploy to curry favor with seniors who view drug prices as a priority. Now, seniors are historically one of the most reliable voting blocs to turn out in elections. Now, Trump carried the demographic by 7 percentage points over Democrat Hillary Clinton in the 2016 race. But some surveys show Trump's support slipping among seniors. Now, an AARP poll last week showed Trump just 1 point up on Democratic nominee Joe Biden among Florida voters over 65. In 2016, Trump beat Clinton in that group by 17 points. Trump's remarks in North Carolina made it hard to ignore the politics involved in sending cash to seniors. Now, nobody's seen this before. These cards are incredible. The cards will be mailed out in coming weeks. I will always take care of our wonderful senior citizens. Joe Biden won't be doing this, Trump said. So guys, if you watched all this video, and I hope you did, now, tell me what you think in the comments below. If you think Trump is just doing this for his political and coming up election. But my opinion is he's doing it for his election, trying to win seniors over to vote for him. And he's doing all this other stuff the same way. That's my opinion. Everybody's got their own opinion. Now, I don't judge nobody for what they say. Everybody's got their own right to their own opinion. Okay? So just let me know what you think. I mean, $200 ain't much, but like I said to start with, it's better than nothing. And a lot of people has trouble paying for prescriptions or co-pays or whatever it may be. A lot of people has that problem. And some medications is so expensive. I mean, I don't even see how some people pays it. I mean, it's ridiculous. So guys, let me know what you think in the comments below. And I've got another, I think, 2 more videos later today. But let me know what you think in the comments below. Guys, until the next time, peace out. I love you.